Hello, good afternoon. I'm Marvin. I'm a student nurse, and I'm here to set up a primary bag and a secondary bag. But my main goal is to administer this secondary medication bag. Um, can you please say your first and last name, Jeffrey Jones, and your date of birth, March 14, 1998? Perfect. All right. I would want to make sure that I have the right equipment, so I have the secondary bag with this tubing and the hanger, and also the primary bag with its tubing. So the solutions, it's normal saline. Check the color, clarity, expiration date if needed, and also with the secondary bag, I would check again for color, clarity, expiration date. So we can start it off by hanging the or spiking the primary bag. So with this tubing, I would make sure that the clamps are all clamped, um, which it is, and then I would remove the covers. And maintaining medical sepsis, I would puncture the bag as clean as possible. Okay? Okay, good to go. Alright. And then I would make sure that the chamber is half full. At least half full. Okay, that's perfect. From this point, I would prime my tubing. Okay. And also, by the way, this end should have a cap. So since we couldn't find the right cap. Um, if there was one, I would uncap it and maintain sterility at all times. Okay, so I would make sure that the tubing does not have any bubbles, and if it did, I would try to flick it out. Okay, right, and then I'll set it up into the pump. Okay, right. So okay, so let's say the pump took the tubing. Alright. Then from this point, I would clean the saline lock of the patient. Clean this end. 15-20 seconds. Alright, done. And insert it. Oh, make sure this is clamped at first. Then once I connect the tubing, then I would unclamp it. And from this point, I would unclamp everything and make sure that it's set up to the right volume and the right prescribed rate. Okay? So while that's infusing, I would prepare my secondary bag. Alright. So with a secondary bag, it's a medication, so do 5 rights: right dose, right drug, right patient, right route, right time. Do compare it with the MAR, along with the ID band, which I already did, and I would see again if this is the right drug, which it is, and with my tubing. Okay, let's pretend that didn't happen. It should be clamped at all times, and as to maintain sterility, I would puncture it. Alright. Good to go. Alright, so, and since I want to administer this first, I would get the blue hanger and and I would fill the chamber again halfway. Alright, and as minimally as possible, I would, while priming my tubing, I would remove only a drop or two of the medication. And if there are any bubbles, I'll flick it towards the end. Okay. Okay. And then I would stop the primary infusion. So stop that for now. And then I'd connect the secondary tubing to the first part of the primary tubing. Clean it 15-20 seconds. Good. And then attach. Alright, then I would make sure that I would set up the secondary bag with the appropriate volume and the prescribed dose. And from that point, before I press start, I would make sure the clamps are unclamped. Alright. And then I would start the infusion of the medication. From this point, I would clean my area, document, and that's it. Thank you.